If you're waking up multiple times every night to use the bathroom, I need you to hear this. For over 15 years, I've been working as a urologist here in Toronto, and I've seen thousands of men who thought their prostate problems were just an inevitable part of getting older. But here's what most people don't know. An enlarged prostate isn't always about age. In many cases, it's about daily habits you're probably not even aware of, and silent inflammation that's been building up for years. I'm Dr. Emily Carson, and today I want to share something that could change your life. Whether you're over 40 and starting to notice changes in your urinary habits, or you simply want to avoid the problems that affect so many Canadian men as they age, this information is crucial. We're going to talk about the real causes of prostate enlargement, the subtle signs you shouldn't ignore, and most importantly, the lifestyle changes that can actually protect or even restore your prostate health. Now, I know what you're thinking. You've probably heard that prostate problems are just part of being a man over 60. That's what we've been told for decades, eh? But what if that assumption is wrong? What if an enlarged prostate isn't a natural consequence of aging, but rather the result of overlooked daily habits and silent inflammation that we have more control over than we think? Let me start by explaining what we're dealing with. The prostate is a small gland, about the size of a walnut, located just below the bladder and surrounding the upper part of the urethra. Its main job is to produce fluid that nourishes and transports sperm. When you're young, this gland is small and doesn't cause any issues. But as you get older, particularly after 40, the prostate often begins to grow. This condition is called benign prostatic hyperplasia, or BPH for short. Here's where it gets interesting. While we often associate this growth with aging, the science tells us something different. The primary driver isn't just the passage of time. It's a hormone called dihydrotestosterone, or DHT. As men age, testosterone gets converted into DHT by an enzyme in the prostate tissue. Over time, DHT stimulates the growth of prostate cells, causing the gland to enlarge. This is a medical fact, but here's the thing. Not all men experience this at the same rate or severity. Why? Because there are other factors at play, and many of them are within your control. Inflammation is one of the biggest factors that nobody talks about enough. The prostate can become irritated due to infections, stress, or even dietary factors. When inflammation becomes chronic, even if it's mild and doesn't cause obvious symptoms, it creates an environment that encourages prostate growth. Think of it like this. Your body sees the inflammation as a problem that needs solving, and one of its responses is to build up tissue in the area. Unfortunately, in the prostate, this protective response leads to enlargement that causes its own set of problems. This accumulation of cells happens primarily in what we call the transition zone of the prostate, which is the area surrounding the urethra. As this zone grows, it starts to squeeze the urethra like a hand gripping a garden hose. The result? You have difficulty starting urination, a weak stream, the feeling that you haven't completely emptied your bladder, and of course, those frequent nighttime trips to the bathroom that are robbing you of sleep. Now, let me address something important. Some of you reading this are probably thinking, but Dr. Carson, I already do everything right. I drink water, I eat well, I exercise, and I still have an enlarged prostate that wakes me up multiple times a night. I hear you, and you're not alone. This is actually one of the most common frustrations I see in my practice. Here's the truth. While lifestyle changes can significantly reduce your risk and even improve symptoms, they're not magic. Some men have genetic factors that make them more susceptible. Some have underlying conditions that complicate things. And sometimes, despite our best efforts, medical intervention becomes necessary. But that doesn't mean lifestyle changes are useless. They're still crucial, even if you need medication or other treatments. They can make those treatments more effective and improve your overall quality of life. Let's talk about the specific daily habits that contribute to prostate problems, because this is where you have real power to make changes. First, let's discuss hydration, but not in the way you might expect. Everyone talks about drinking 2 liters of water a day, and yes, that's important. But here's what nobody mentions. It's not just about the amount, it's about the timing and the type of fluids you're consuming. Many men make the mistake of restricting water intake because they're tired of running to the bathroom. I get it, but here's the problem with that strategy. When you don't drink enough water during the day, your urine becomes more concentrated, Concentrated urine irritates the bladder and prostate, which can actually make symptoms worse. It's like putting salt on a wound instead of washing it clean. Here's my practical advice. Drink most of your water during the morning and early afternoon. Have a glass when you wake up, another with breakfast, one mid-morning, one with lunch, and one in the early afternoon. Then taper off significantly after about 5 or 6 in the evening. This way, you're staying hydrated throughout the day when it matters, but you're not loading up on fluids right before bed. And let me tell you something that might surprise you. Coffee, tea, and alcohol are not your friends when it comes to prostate health. I know. Many of us Canadians love our Tim Hortons run in the morning, and there's nothing quite like a beer while watching the hockey game. But caffeine and alcohol are both bladder irritants and diuretics, meaning they make you produce more urine and they irritate the tissues. If you're having prostate symptoms, try cutting back significantly or eliminating these for a month and see what happens. You might be amazed at the difference. Now let's talk about diet, because what you eat has a profound impact on inflammation in your body, including in your prostate. Foods high in saturated fats and processed sugars promote inflammation. We're talking about things like red meat, fried foods, packaged snacks, and sugary drinks. I'm not saying you can never have a burger, but if these foods are staples in your daily diet, that's a problem. On the flip side, anti-inflammatory foods can help protect your prostate. Tomatoes are excellent because they contain lycopene, a powerful antioxidant that's been shown in studies to support prostate health. Fatty fish like salmon, which we have plenty of here in Canada, are rich in omega-3 fatty acids that fight inflammation. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds that may help regulate hormone levels. Nuts, particularly walnuts and almonds, and seeds like pumpkin seeds are also beneficial. Here's a simple rule I give my patients. Try to fill half your plate with vegetables at every meal. Include a serving of fatty fish at least twice a week, snack on nuts instead of chips, and add berries to your breakfast. These aren't drastic changes, but over time they add up to significant improvements in inflammation levels throughout your body. Let me share something from my practice that really drives this home. I had a patient, a gentleman in his early 70s from Mississauga, who came to see me because he was waking up 5 or 6 times a night to urinate. He was exhausted, irritable, and his quality of life had plummeted. His PSA levels were elevated and his prostate was significantly enlarged. We talked about his lifestyle, and it turned out he was eating fast food several times a week, drinking multiple cups of coffee throughout the day, and having a few beers every evening. I didn't put him on medication right away. Instead, we made a deal. He would spend 3 months making specific dietary changes, cutting out fast food, limiting coffee to 1 cup in the morning, eliminating evening alcohol, and focusing on anti-inflammatory foods. He was skeptical, but he committed to trying. 3 months later, he came back for his follow-up. His nighttime bathroom trips had decreased from 5 or 6 to 2 or 3. His stream was stronger, and he felt like he was emptying his bladder more completely. His energy levels were up because he was sleeping better. Were his symptoms completely gone? No. Did we eventually add medication to his regimen? Yes. But those lifestyle changes made a real measurable difference, and they made the medication more effective when we did add it. Physical activity is another crucial factor that doesn't get enough attention. Regular exercise helps reduce inflammation, improves circulation, and helps maintain a healthy weight, all of which are beneficial for prostate health. You don't need to become a marathon runner. Simple activities like walking for 30 minutes a day, swimming, or cycling can make a significant difference. Here in Canada, we're fortunate to have beautiful outdoor spaces. Take advantage of them when the weather allows, and when winter comes around, find indoor activities or embrace winter sports like cross-country skiing. There's also evidence that exercises targeting the pelvic floor muscles can help with urinary symptoms. These are called Kegel exercises, and they're not just for women. To do them, you contract the muscles you would use to stop urinating midstream, hold for a few seconds, then release. Do this 10 times, 3 times a day. It might feel weird at first, but these exercises can strengthen the muscles that control urination and improve symptoms over time. Stress management is another piece of the puzzle that's often overlooked. Chronic stress contributes to inflammation throughout the body, including in the prostate. When you're stressed, your body releases hormones like cortisol, which can disrupt the balance of other hormones, including those that affect prostate health. Finding ways to manage stress, whether through meditation, yoga, spending time in nature, or activities you enjoy, isn't just good for your mental health, it's good for your prostate too. Sleep quality matters as well, and this creates a bit of a vicious cycle for men with prostate problems. Poor sleep can increase inflammation, but prostate symptoms disrupt sleep. Breaking this cycle often requires addressing both issues simultaneously. This is where all the strategies I've mentioned come together. Better hydration timing, dietary changes, exercise, and stress management can all contribute to better sleep quality, which in turn helps reduce inflammation and improve prostate health. Now, let's talk about what to watch for. Early detection of prostate issues is crucial, whether we're talking about BPH or more serious conditions. Some signs are obvious: difficulty starting urination, a weak stream, dribbling at the end, the feeling of incomplete emptying, and frequent nighttime urination. But there are more subtle signs too. If you're finding that you need to urinate urgently and can't hold it like you used to, that's significant. If you're experiencing pain or burning during urination, that needs to be checked out right away. Blood in the urine is never normal and always requires immediate medical attention. Pain in the lower back, hips, or pelvis that doesn't have an obvious cause should also be evaluated. And if you're experiencing any sexual dysfunction, particularly difficulty maintaining an erection or pain during ejaculation, these can sometimes be related to prostate issues as well. Here's something important. These symptoms don't always mean something serious is wrong, but they do mean you should get checked out. I've had countless men tell me they avoided coming in because they were scared of what we might find. I understand that fear, I really do. But here's the thing. Early detection dramatically improves outcomes for any prostate condition. Waiting and worrying doesn't help anyone. Regular screening is important, especially once you reach 50 or 45 if you have risk factors like a family history of prostate problems. A simple PSA blood test and a digital rectal exam, which I know nobody loves but takes less than a minute, can provide valuable information about your prostate health. These screenings allow us to catch problems early when they're most treatable. Let me address the elephant in the room: medication and surgical interventions. Sometimes, despite our best efforts with lifestyle changes, medication becomes necessary. There are several types of medications that can help. Alpha blockers relax the muscles in the prostate and bladder neck, making it easier to urinate. 5-alpha reductase inhibitors actually work to shrink the prostate over time by blocking the conversion of testosterone to DHT. Sometimes we use both types together for better results. For some men, minimally invasive procedures or surgery become the best option. These might include procedures that use heat, lasers, or other technologies to remove or reduce prostate tissue. Full surgery, like a transurethral resection of the prostate or TURP, is less common now than it used to be, but it's still sometimes the best choice for severe cases. The key is that these treatments aren't failures. They're tools we have available when we need them. And here's the important part. Even if you need medication or a procedure, the lifestyle changes we've talked about still matter. They can make treatments more effective, improve your overall health, and enhance your quality of life. I want to circle back to something crucial. Some of you are dealing with prostate issues right now despite doing many things right. You're frustrated because you feel like you've tried everything and you're still struggling. If that's you, please hear this. You haven't failed. Prostate health is complicated. Genetics play a role. Age, despite what I've said about it not being the only factor, is still a factor. Sometimes bodies just don't cooperate the way we'd like them to. What I want you to understand is that the lifestyle changes I've discussed aren't all or nothing propositions. They're not magic pills that work for everyone in the same way, but they do improve your odds. They do reduce inflammation. They do support your overall health. And when combined with appropriate medical treatment, they give you the best possible outcomes. Let me also say this. If you're not seeing results from lifestyle changes alone, that doesn't mean you should give up on them. It means you need to add medical intervention to the mix. There's no shame in needing medication or procedures. The goal isn't to avoid medical treatment at all costs. The goal is to have the best quality of life possible, however we get there. I've been practicing medicine for over 15 years now. And if there's one thing I've learned, it's that prostate health isn't just about the prostate. It's about your overall health, your lifestyle, your stress levels, your sleep, your relationships, and your mental well-being. Everything is connected. When you take steps to improve one area, you often see improvements in others. The choices you make today, what you eat, how you hydrate, when you take action, determine your health tomorrow. Prostate problems don't wait, and neither should you. If you're experiencing symptoms, don't ignore them. If you're over 40 and haven't had a screening, schedule one. If you're already dealing with prostate issues, talk to your doctor about whether your current treatment plan is really working for you. And remember, you're not alone in this. Millions of Canadian men deal with prostate issues. It's one of the most common health concerns for men as they age. There's no reason to feel embarrassed or to suffer in silence. We have so many tools available now, from lifestyle interventions to medications to procedures, that can genuinely improve your symptoms and your quality of life. Take control where you can. Make the changes that are within your power to make. And don't hesitate to seek help when you need it. Your prostate health matters, not just because of the physical symptoms, but because of how those symptoms affect everything else. Your sleep, your relationships, your confidence, your enjoyment of life. You deserve to sleep through the night. You deserve to not constantly worry about where the nearest bathroom is. You deserve to feel confident and comfortable in your own body. And with the right combination of lifestyle changes and medical support when needed, those things are absolutely achievable for most men. So here's what I want you to do. Starting today, pick one thing from what we've discussed and commit to changing it. Maybe it's adjusting when you drink water. Maybe it's adding more vegetables to your meals. Maybe it's finally scheduling that appointment with your doctor that you've been putting off. Just one thing. Then, when that becomes habit, add another. Small changes, consistently applied over time, create significant results. Your prostate health is in your hands more than you might think. Yes, there are factors you can't control, but there are so many that you can. And those controllable factors can make a real, tangible difference in your symptoms, your health, and your life. Don't wait until problems become severe. Don't assume that discomfort is just something you have to live with. Take action now while you still have the power to make a difference.